Hey everyone, happy 2022 and thanks for joining us today for our first of monthly webinars. Today we're going to talk about an integrative approach to COVID. To start out, I'd like everyone to put a message in the chat box of one thing that you can do to help minimize the impact that COVID has on you if you get it. I'll just give everyone a minute to put your answer in the chat box. And at the end of the webinar, we'll see what we've learned, see how our answers maybe change. Okay, so what we're going to cover today is what is integrative medicine, a little bit of a discussion about disease versus health balance. We're going to talk about COVID and inflammaging, and that is not a typo, that was meant to be inflammaging. What you can do to reduce your risk of getting COVID, and what you can do to support recovery. I'm going to talk a little bit about immune support versus immunorejuvenation. And then I'm also going to talk about some cutting edge treatments. And then at the end, we'll go over any questions that we have time to get to. I would just ask that you put any questions you have in the chat box, and then we'll discuss them at the end. What we're not going to cover is we're not going to talk about vaccines, masks, monoclonal antibody therapy, antiviral therapy, or anything else that's not on the list of things that we're going to cover. Okay, integrative medicine. First of all, I'd just like to talk briefly about what the definition of integrative medicine is and what it is for the purpose of this discussion as well. So integrative medicine, I think of it as the umbrella under which all forms of healing modalities with evidence lie. So under that umbrella is conventional medicine, naturopathic medicine, chiropractic medicine, energy healing, sound healing, craniosacral therapy, osteopathic medicine, massage, aromatherapy, basically any type of healing modalities that there's evidence. And I think the evidence is the important thing that I'd like to mention right now, because everything that we're talking about in this talk and everything that we do at Boost is all evidence-based. The evidence might not be as robust as a giant randomized placebo-controlled trial of 2 different drugs, but it does have evidence. And so that, just know that everything that we're talking about does have evidence. And I'm happy to share that, and I'll give my resources for this particular talk at the end, but if anyone has any additional questions and wants any more resources on the evidence, I'm happy to share them. All right, first we're going to start out with a 35,000-foot view of disease versus health. I think it's nice to kind of start broadly, and then we'll kind of zero in on more specifics. So the way anyone who's been my patient knows that I talk about the balance all the time between all the things that are stressing out our bodies and our biological systems, our metabolic health. And so as you can see from this balance here, if our biological systems are stronger than all the internal and external stressors, we're going to be healthy. We're not going to be in a state of disease. What are the biological systems, and what are some of the internal and external stressors? Stressors are pretty much anything that's hitting us, that our bodies are being exposed to every day. So infections, electromagnetic fields, toxins, emotional stressors, injuries, deficiencies in vitamins and nutrients, allergies, deficiencies in relationships, any deficiencies that we have. And then biological systems are all of our biological systems that allow our bodies to work optimally, our immune systems, our detox systems, metabolic systems, hormonal systems, et cetera. So if our stressors if we have more stressors than our biological systems have strength, then we're going to get tipped into a state of disease. And so I think if we think of that broadly when we're thinking about COVID, it kind of helps us to look at, okay, what can we do to make our immune systems more robust so that hopefully if we do get COVID, which chances are with Omicron, the vast majority of us are going to get exposed to it, we don't have a significant course of the disease. Let's zoom in a little bit more here. So in the functional medicine world, I like to think about the 4 pillars of health. And the 4 pillars of health that I refer to are sleep and stress, nutrition, gut health, and exercise. And if we think about addressing those 4 things are going to help us to keep our biological systems stronger, or potentially weaken our biological systems depending on how we're addressing all of them. So I'm going to talk about these particular areas and how they impact us with respect to COVID. Before that, I'd like to just briefly talk about inflammaging. Inflammation, everyone's heard that word, but a lot of people haven't heard the word inflammaging. So basically anything in our body, anything that's going to increase our inflammation is going to accelerate aging and everything that's associated with aging. And if you look in the lower right-hand corner there, you can see that inflammation is basically correlated with all of the diseases that we think of as diseases of aging. So cancer, heart attacks, strokes, autoimmune diseases, arthritis, neurologic diseases, et cetera. And if you look in the upper right-hand corner, you can see that it is related to pretty much every type of symptom in our body. So sores, rashes, illnesses, fatigue, aches, et cetera. And so as any of my patients know, I focus on anything that we can do to reduce our inflammation, and inflammaging is going to reduce our symptoms. And inflammation plays a huge role in COVID as well, as I imagine probably a lot of you have heard. How does it work in COVID? So this might look a little bit scary, this diagram, and words like the NLRP3 inflammasome. Basically what you need to know is inside our cells, we have these little inflammasomes, which the upper right-hand corner there is a little icon of what an inflammasome looks like. What that is it's a little signaling platform that gets activated by certain viruses. And then it releases immune molecules called cytokines that then in theory are designed to help our body get rid of the virus. Now, what we found in the case of COVID and many other viruses as well, is that sometimes we release too many of these cytokines and then it causes significant inflammation, significant symptoms. And so if you look at the lower left-hand diagram there, we know that people that already have challenges with metabolic problems, obesity, type 2 diabetes, things like that, are going to be more likely to activate that inflammasome, that NLRP3 inflammasome. And then that's going to be more likely to reduce more of those cytokines. Those cytokines are going to cause more inflammation in places like the lungs. And that's why people sometimes will have really severe courses where they can't breathe. And then in some cases actually die from COVID. Why is it that certain people will have really bad courses of COVID and other people won't? It really comes down to activation of this inflammasome and releasing of inflammatory cytokines. So again, anything that we can do to make our metabolic system stronger and decrease our inflammation is going to decrease our chance of activating this inflammasome and decrease our chance of having a worse course of COVID. One thing that's nice with Omicron is it seems to be hitting the upper respiratory system more than the lower respiratory system. So get inflammation in the head and the throat, but not as much going down into the lungs. And in many cases, what is causing people to die from COVID is the inflammation in the lungs. So that's why we're seeing that not as many people are dying from the Omicron variant. So anytime you see that icon of the inflammasome in this presentation, whatever topic I'm talking about is directly impacts that inflammasome. And we're looking for ways to mitigate the impact of COVID on us. So what we're looking is for things that are going to minimize the activation of that inflammasome. The other thing I want to comment on is I'm going to have this other icon, which looks like a fire extinguisher putting out a fire. So anytime you see that photo in the presentation, that is ways that is going to mitigate inflammation. So there's certain supplements, certain treatments that are going to mitigate inflammation, and there's certain treatments that are going to mitigate the inflammasome, which is more specific to viral activation and COVID. And then there's some things that are going to do both. So that's just a reminder. We know that we learn things better if we have visuals to associate with things that we're learning. Okay, so back to the 4 pillars. We're going to kind of address the different 4 pillars with respect to COVID and how we can mitigate. So let's talk about sleep first. So we know for sure from many studies in the past that if we don't get enough sleep, we're more likely to have longer durations of viruses. We're more likely to get viruses. Specific to COVID, we know that sleep deprivation is more likely to activate that inflammasome that we talked about, release those cytokines, and more likely to have a worse outcome. We also know that not enough sleep is going to make it more virulent, which means you're going to have a higher viral load, and you're going to be more likely to spread it to other people. So getting plenty of sleep is imperative, I think, for health in general, but particularly with COVID. What is enough sleep? So for most people, you need to get between 7 to 9 hours of actual sleep, which means that most people need to be in bed for 8 to 10 hours, because most people are not getting 100% efficiency. I use something called the Oura Ring, which is a biofeedback device that measures my sleep every night. It looks at the difference between deep sleep, REM sleep, light sleep, whether I'm awake in the night. And that's a way that you can kind of track it. There's also the Whoop device, which is another biofeedback device. But I recommend to all of my patients, to anyone I talk to, doing whatever you can to optimize your sleep. And that's a different discussion than we have time to go into right now. But suffice it to say that I think it's probably the least expensive, most effective performance enhancing thing that we have out there that a lot of people just aren't taking advantage of. So we have lots of techniques to help people optimize their sleep. Stress management. Okay, so this you can see again, or back to the sleep, that you can see the icons at the top. So decreasing inflammation and decreasing the inflammasome. Stress management, same thing. And again, this is all evidence-based. So we know that with things like mindfulness, breathing exercises, guided imagery, et cetera, those things all decrease the activation of that inflammasome. And the inflammasome, again, is going to release inflammatory cytokines that are going to make us sicker. Also, stress management likely reduces CRP. So the CRP is a high sensitivity CRP is a blood test that we do that checks for systemic inflammation. We've done studies to show that pre and post stress management and mindfulness activities, people's CRP actually goes down. So again, stress management, easy, low-hanging fruit in terms of not expensive. You can do it every day at home. You don't need to go anywhere. I recommend people do things like gratitude practices. It takes 5 minutes in the morning, 5 minutes at night. Breathing exercises. If you exhale twice as long as your inhale, the 4-7-8 breath is another great one. I like things that are easy that people are actually going to do. You could certainly do, an hour of meditation every day, and that might be great, but most people don't have time for that. Wim Hof breathing is an excellent type of stress mitigation that a lot of people find is really helpful. It also helps with autonomic nervous system regulation. Ziva meditation is another online course that you can do for meditation. I get a lot of people kind of telling me that I can't meditate, my mind is too busy. And I would just say that if you feel like your mind is too busy to meditate, you probably need it more than ever. And there's lots of ways that we can help to get your nervous system a little bit more relaxed without taking a lot of time. And I just want to make sure that we recognize that our nervous systems, our sympathetic nervous systems, are super important. We're alive now because our ancestors were really good at avoiding saber-toothed tigers. So thank your nervous system for everything that it's done, but recognize that it's better for us to be in the rest and digest most of the time. So what has happened, I think, over time, and particularly in the past 2 years with COVID, is our nervous systems tend to lie more in the sympathetic, which is a flight or fight, and not enough in the rest and digest. And that makes it harder for us to fight illnesses, harder for us to avoid illnesses in the first place, more likely that we're going to contract and spread COVID. Okay, so moving on now to nutrition and supplements. I'm going to go over some of the main areas that we have evidence on. We're not going to cover everything in this short talk here. I'm going to talk about the anti-inflammatory diet, flavonoids, zinc, vitamin C, melatonin, elderberry, and vitamin D. And then I just want to mention also vitamin A, vitamin E, omega-3s are also useful. I'm not going to talk about them extensively though. So if you look at this picture on the right, we've got a variety of colors of vegetables and fruits. And the reason we want to eat lots of, I think everyone knows that we should be eating vegetables and fruits. Since I've started asking people a few years ago how many vegetables and servings of vegetables and fruits they have a day, I've had almost no one who has what we would recommend, and we being the people that study these things. So I think regardless of what type of diet you endorse, whether it's vegan, paleo, keto, omnivore diet, I think everyone will agree that we want to have a diet that is mostly plant-based with lots of different colors taking up most of the plate. So we should be having 5 to 7 servings of vegetables and 2 to 3 servings of fruit daily. Why are the fruits and vegetables so healthy for us? It all comes down to the flavonoids. And I'm going to talk about that in a minute. This is a pyramid here from Dr. Weil, and there's lots of other ways to eat an anti-inflammatory diet, but I think this is just kind of a nice pictorial. As you notice, it's way different from the food pyramid that we grew up with, which had, kind of the grains at the bottom. Vegetables and fruits you can see are at the bottom. And then I think animal protein should be more of a condiment rather than a main meal. And then all the grains should be up above the vegetables and the fruits. Again, why are these anti-inflammatory diets beneficial? Because anything that we can do to decrease inflammation is going to decrease our aging, and it's also going to decrease the risk of us having worse symptoms. So again, just have that in the back of your mind. Is what I'm doing increasing my inflammation or decreasing it? If it's increasing it with respect to COVID, it's going to increase your chance of having worse symptoms. So flavonoids, what are flavonoids? Flavonoids are the plant pigments that are antioxidant. They're water soluble. They're the pigments that cause all these beautiful fruits and vegetables to be different colors. And flavonoids have been found in studies to reduce that inflammasome signaling, and therefore reduce all those cytokines from being released. So if you're eating lots of different plants and vegetables with different colors, you're more likely to have a more mild outcome with COVID. Some specific flavonoids that have been studied specifically for COVID and viral mitigation. The flavonoids I'm listing, and then also the plants and vegetables that you would more likely recognize. So Chinese skullcap, licorice, onions and apples, tomatoes, oranges, nuts and berries, chamomile, parsley, celery, turmeric root, and green tea all have pretty good evidence to show that they're going to help decrease that activation of the inflammasome. You don't have to remember all those. I think that the bottom line thing to remember is that your plate should be 50% at least, if not more, covered with vegetables and fruits of all different colors every time you eat. I'm going to go through a few of the vitamins and minerals specifically that have specific evidence for COVID. So zinc, I think probably at this point, everyone's heard about the benefits of zinc, but it actually seems to prevent the entry of the virus into the cells. And so that's why zinc can be beneficial. The picture on the upper right-hand corner shows a bunch of foods that have zinc in them. I think another way that I like to think of eating and making sure that we get enough of these nutrients is to think about, is this food that I'm eating nutrient dense or calorie dense? We want to be eating nutrient dense foods. Sometimes they might be calorie dense as well. A couple things that are great foods that are nutrient dense are organ meats. So if that's something that you're open to, if you're not, you can take supplements. Ancestral Supplements makes a nice supplement that has organ meats in there. Smash fish are really good. So sardines are a really good source of nutrients. Shellfish are as well. Generally speaking, the animal proteins are more nutrient dense. If you can certainly get the nutrients in other ways as well, but if you're looking at nutrients versus quantity, you're going to get a higher amount in organ meats probably than anything else. Vitamin C is great at inhibiting that NLRP3 inflammasome again. And so that's going to be something that is going to reduce you from having a poor outcome and significant inflammation with COVID. Vitamin C, we've all heard of that probably our entire life in terms of helping our immune system. And it's something that I think with respect to COVID, like right now with the winter, that would be a good supplement for everyone to be taking regularly. Melatonin. Melatonin is not one I think that people think about as much when it comes to immunity. People link melatonin to sleep, and it's important to get enough sleep to get enough melatonin. But melatonin itself is actually going to inhibit the NLRP3 inflammasome. And so that's something that you can take supplementation of melatonin. The dose of melatonin for initiating sleep is actually quite low, less than 1 milligram, usually 0.3 milligrams. Higher doses are used more for inflammation, anti-inflammatory effects, and it's also a good protector and mitigator for cancer, believe it or not. And so I recommend to a lot of people to take a sustained release micronized version of melatonin, and that helps with your immune system, helps with your sleep, helps with inflammation. Melatonin is kind of a wonder hormone in that way. Everyone who studies sleep that I know of is pretty much taking melatonin. There's a great book that's called Why We Sleep by Matthew Walker, which talks about sleep. As we get older, oftentimes we don't sleep as well. We don't release as much melatonin, and that can really impact our health overall. Elderberry is another one that I think has gotten a lot of press over the past couple of years with COVID. The one thing I want to point out about elderberry is it actually does increase inflammatory cytokines. And so there's been discussions over whether or not it's good to take once you get COVID. Certainly it's great for prevention. There was a recent study that did a literature review, and it didn't show any evidence that it should be stopped with active infection, but I just wanted to throw that out there, that it's probably not the best thing to be taking with active infection, but it's great for prevention. Vitamin D. So vitamin D is another one I think that there's been a lot of news about, and that also is going to help decrease that NLRP3 inflammasome activation. Vitamin D, naturally we can get from our skin, but we have to be in the tropics between the hours of 10 a.m. to 2 p.m. for probably 20 minutes and naked in order to get enough vitamin D. And so basically everyone that I see living in the States primarily, or Canada, are not, there's no way to get enough vitamin D through our skin. So we have to supplement. From a conventional standpoint, as long as you're above the level of 20, it's going to look as if your vitamin D levels are okay. I think some of the conventional labs are going up a little bit higher, but I never see them as high as 60 to 80, which from an integrative and functional perspective, that's optimal. So pretty much everyone needs to be supplementing with vitamin D, and that vitamin D has been shown to not only prevent or help mitigate the COVID, but also mitigate the impact once you get COVID. So it's been used for prevention and treatment. I would recommend probably most people in the Northern Hemisphere winter right now, or Southern Hemisphere winter, when that happens, to probably be taking at least 5,000 units a day, up to 10,000 units. And depending on where your numbers are, you might need to do higher doses or IV vitamin D to get up to an optimal range before you can take a daily amount to maintain that optimal range. Probiotics. So we could have a complete discussion just on microbiome, which I've done previously, but suffice it to say that gut health and the microbiome are super important for the immune system. There have been studies looking specifically at lactobacilli and bifidobacteria supplementation to reduce respiratory infection duration with respect to COVID. And I just want to spend a couple slides just talking about the microbiome in general. So we talk about our enteric nervous system, which is the nerves around our guts, around our GI system. And actually our enteric nervous system has more nerves than our central nervous system, which is kind of mind-blowing when I first learned that. And so we kind of think of our brain as being the central operating platform for our body, but our gut actually, when we talk about like, I have a gut feel about something, there's a lot of truth to that in terms of, I think we need to start tapping into that a little bit more because we have more nerves there than in our brain. When we look at what's happening with our gut, a good portion of our immune system actually lies in our gut. So it's called our gut-associated lymphatic tissue. And if you look at where all those cells at the top where it says tight junctions, and then on the right where it says leaky and inflamed, if we have inflamed cells in our gut, it's going to activate our immune system and cause more inflammation. And then it's going to send messages to the brain via the vagus nerve, and that is going to cause inflammation in the brain. So we get kind of this positive feedback of inflammation in the gut causes inflammation in the brain, which causes inflammation in the gut. And for example, if you went out and got a head injury and you got inflammation in your brain, that's going to impact your microbiome. Vice versa, if you get food poisoning, that's going to impact your inflammation in your brain, causing symptoms like depression, anxiety, things like that. And we are seeing with this pandemic, now part of it is probably just isolation and just the stress of the pandemic, but we're seeing a lot of people having a lot of emotional symptoms during and after COVID, depression, anxiety, things like that. And probably a lot of that is disruption of the microbiome causing that inflammation. So again, it all comes down to inflammation, inflammaging. So anything that we can do to optimize our gut is going to help minimize that. Okay, so now I'm going to move briefly to talk about some supplements that can support recovery. The supplements that we were just talking about were supplements that are more for prevention. Once you've had COVID and you're trying to maximize your recovery, melatonin and vitamin D are also very good for that. And we already discussed that. Glutathione, cordyceps, astragalus, and garlic are also great for helping with recovery. And they're going to help decrease inflammation and also decrease the NLRP3 inflammasome. I'm not going to talk about all of them, but I am going to talk about glutathione briefly. So glutathione is the body's main antioxidant. It's produced in the liver. It's actually the most abundant antioxidant in the lung. It has both antiviral and anti-inflammatory actions, and it's also going to upregulate your vitamin D synthesis. And they've done studies looking at glutathione treatment specifically for COVID pneumonia, and it does have statistical improvement in the longevity of the disease process with taking glutathione. So supplementation with glutathione can be done either via IV or oral form. I like the liposomal form, which is a squirt under the tongue, which absorbs pretty well. It's almost as bioavailable as IV nutrients, not quite as much, but it's less expensive, and then you don't have to go into an office. Some other interventions that support recovery, and I'm not, again, these could be individual talks on each of these, but I just want to do an overview here. So osteopathic manipulation techniques, including craniosacral therapy, qigong, breathing exercises, exercise and pulmonary rehabilitation. So exercise just meaning moving your body. So maybe after you get COVID, you can't go mountain biking, you can't go skiing, but even just going for a walk and doing some movement is going to help. Mindfulness, including Tai Chi, yoga, meditation, all of those techniques are going to help decrease inflammation. Most of these have direct evidence that they impact the NLRP3 inflammasome as well. That's why I put the inflammasome icon there again. Creativity, this is an interesting one. There's evidence to show that doing things like expressive writing. So maybe you've had COVID and you're still feeling like you don't have great energy. Expressive writing to actually talk about or express what you're going through is actually helpful in terms of mitigating the inflammatory response in your body. Aromatherapy, inhaling essential oils, there's evidence for that improving your immune system. Sleep, we talked about that already. And then environment. So we want to have optimal temperature and optimal humidity for healing. So optimal humidity is probably somewhere around 35 to 45% humidity. Most of us who live in the mountains, the humidity is lower than that. In places like Alaska, the humidity is higher. So anytime the humidity is too high or too low, that's going to impact things. COVID seems to like colder, drier environments. So winter is a perfect time for it to spread. And then also with environment, things like views of nature, getting outside, all of that is going to help our immune systems. All right, quick discussion here on immune support versus immunorejuvenation. So most of what we've been talking about really is immune support because immunorejuvenation is a longer process. Immune support is basically kind of helping our existing immune system. The reason that can be problematic is potentially our immune system is overreacting. And by boosting it, we're going to have an overreactive immune system. And what happens with that is things like autoimmunity. So you see at the bottom that the toggle there from immune exhaustion to immune vitality. If our immune system is constantly attacking things and trying to get rid of dangers, it causes inflammation, immune system gets exhausted. On the other end, what we want to do is kind of it's almost like rebooting our immune system. And that is a better way to look at things, especially after something like long haul COVID. So it's with long haul COVID, our immune system gets a little bit scrambled and it's not working optimally. And so by actually rejuvenating it, we can help it to work optimally again. So it's not just kind of turning up the system on the immune, or turning up the volume on the immune system. It's almost like rebooting it. So one way that I like to reboot our body's immune system and our body's metabolic systems as well is something called autophagy. Autophagy is basically the body's ability to identify damaged cells and get rid of them before they cause problems. And the Pac-Man there is kind of our immune system doing that. In order to upregulate our autophagy, our body needs to not be focusing on digesting food. So again, most of our immune system, or a good portion of our immune system, lives in our gut. If we are constantly eating, we're not able to upregulate our autophagy and deal with our damaged cells. And so quick ways to do that is fasts that are at least 5 days long. So autophagy, when a lot of people do intermittent fasting, which is time restricted feeding. So maybe you only eat for 8 hours of the day and the other 16 hours of the day you're not eating. That's great for metabolic health. That's not going to really help much with cellular cleanup and autophagy. That doesn't happen until you've been fasting for 2 to 3 days. Doing water fast can be dangerous if you've never fasted before. So I usually recommend that people start with something like the Prolon kit, which is what the lower right-hand corner is. It basically is a designed fast that tricks your body into thinking it's fasting. It's not as effective as a water fast, but it's pretty close, and it doesn't have the dangers of someone who potentially has metabolic imbalance to do a water fast where electrolytes could be off. So the Prolon kit is something that you do for 5 days, and then you have a 6th day that's recovery. But during days 3 through 6, your autophagy is increased, as is your stem cell production. So it's a great thing that I recommend people doing quarterly to just kind of get rid of damaged cells. And I think for anyone who's struggling with long haul COVID, this could be a great way to reboot your immune system. Depending on how sick you are, the fasts might be too stressful on you as they are. So we can talk about ways to do a more gentle fast to upregulate autophagy. Finally, I'm going to talk a little briefly about some in-office cutting-edge treatments. Thus far, I've talked more about things that you can do on your own at home and don't require coming into an office. And in general, that's what I like to encourage people to do, just because it's less expensive and you can do it at home. But sometimes we reach a point where it's important to get some treatments in the office to kind of help us get over the hump. So stellate ganglion blocks, I talked about earlier about it being in the parasympathetic versus the sympathetic nervous system. When we're in parasympathetic, we can relax. When we're in the sympathetic, we're not relaxed, and it's hard for our body to heal. So I think of it like if you get that spinning wheel of death, like in that picture here, and your computer just kind of freezes, what do you do to get it to work better? You reboot the computer. When you reboot the computer, it gets rid of all the apps that you don't need, and then it opens and things run smoothly again. You can certainly open up a bunch of apps again, get it to freeze again, but the idea is you're at least rebooting it so it's going to work better until you reopen those apps. And hopefully you change it so that you're not opening everything. So same thing with our brain. I think a lot of us are kind of stuck in flight fight with this pandemic, and we're constantly thinking about things that already happened or things that might happen. It's really hard to be in the present moment. And it's also really hard for our body to be in balance and work optimally when that's happening. So by getting a stellate ganglion block and a vagus nerve block, it kind of is like rebooting your autonomic nervous system. And what it involves is an injection in the neck. That's where the stellate ganglion lives. That's also where we target the vagus nerve. We do it at the C5 level, generally, sometimes C4 or C6. And it's an ultrasound guided injection. The procedure itself takes about 5 minutes. And people overwhelmingly describe a sense of peace after. So they might experience a stressful thing that they've had before, but they don't have the same stress response. So maybe driving in traffic previously, you would have gotten really worked up, but but now after the stellate, you're just there and it's not stressful. So that's a really good thing to help if you're stuck in long haul COVID as well, because that's medical trauma is a huge source of trauma for a lot of us, especially after the past 2 years. Peptides, we could again have a whole lecture on that. Peptides are amino acid sequences that act on various organs in the body. The most common peptide that everyone has heard of is insulin. The two of the peptides that I like for helping with COVID and long haul COVID are thymosin alpha and LL37. They are injectable. You do have to inject them on your own, but they're very small insulin needles. Most people tolerate them really well. And that can really kind of help to give your immune system the rejuvenation it needs to get rid of your long haul symptoms. Ozone therapy is another therapy that we do in the office. That's a picture of me getting ozone therapy. Basically, the multi-pass system that we have takes your blood out, ozone gets injected into that little egg, and then the ozonated blood goes back into your body. And what the ozone therapy is going to do is it's going to regulate T helper cells, which is going to help to support immune rejuvenation. What we've realized is when people have long haul COVID or chronic infections, the problem is not the infection. The problem is our immune system is dysregulated and it's not able to get rid of the infection. That's why, you know, I could get COVID, for example, and you could get COVID, and maybe you get COVID and you don't have any symptoms, and I have long lasting symptoms, and that's all about my immune system. Ozone is also going to increase NAD. NAD is another talk altogether, but NAD kind of is necessary for our mitochondria, which are little engines in our cell, and producing energy there. So if we don't have enough NAD, our mitochondria don't work well, and our biologic systems in general aren't going to work optimally. And then ozone therapy is also an oxidative stress that's going to kill microorganisms. So if you get acutely ill with COVID and you come in and get ozone, it's going to help to kill that virus before it causes long-term symptoms. So ozone is great for acute infections and chronic infections. And it all goes back to that balance again from the beginning of disease versus health. And ozone basically is going to help all of your biologic systems to improve, in large part because of the NAD levels improving. IV nutrition is another treatment that we can do in the office. So all of the vitamins and nutrients that we talked about can also be given in an IV form. And it's just more bioavailable. So if you have inflammation in your gut and you take a vitamin C pill, you may or may not absorb any of it or most of it. And getting an IV form of vitamin C, you're going to get all of it. So it's just a way to get more of those nutrients in. Liposomal forms of vitamins, which are the squirts under the tongue, or phytosomal delivery with pills as well, liposomal with pills as well, is a better way to get them in than just regular supplement forms. A lot of supplements, depending on your underlying gut health, you're probably wasting your money. You're not going to absorb a lot of them. Once your gut health is optimal, then you'll be able to absorb supplements, no problem. But in the meantime, getting supplements that you're definitely absorbing is important. Okay, so summary, we talked about what integrative medicine is. We talked about the disease versus health balance. We talked about COVID and inflammaging. We talked about what you can do to reduce your risk of getting COVID. We talked about what you can do to support recovery. We talked about immune support versus immunorejuvenation. And we talked about some cutting edge treatments. And at this point, I'd like everyone to put in the chat box, what is one thing you can do to help minimize the impact COVID has on you if you get COVID? So take a minute or two again to write your answer at this point after hearing the talk. And then as you're doing that, also any questions you can put in there as well.
Wow, thank you, Dr. Mulcahy. So much really helpful, relevant information. I can see some of the questions are starting to come in, so I might read you a couple if that's okay.
Yeah, that sounds great.
Great. This is from JT. For someone who suspects chronic mold, what kind of approach would you recommend? And we also have a question here from Peter about heavy metal toxicity. And maybe you could address that in your response also.
Yeah, great. Good question. So anyone that's suffering from any underlying conditions such as heavy metals or mold, it's kind of in the same category. Those, when we go back to, I'm going to pull up that balance again. So if we look at the internal and external stressors versus the biologic systems, both mold and heavy metal toxicity, they are both going to be increasing your stressors. So if my biological systems are, strong, and they're the same strength as yours, but I have heavy metal toxicity and you don't, I'm going to be more likely to get disease or to get sick, basically. And so what we want to do is address those as soon as possible to help to make sure that you can get over COVID. And we are finding that probably a vast majority of people that have long haul COVID, the reason is that they're already fighting all these other things. How do I approach mold specifically, or how do I approach heavy metal toxicity? They're both different, and that's a whole different discussion, but ozone's great for mold. Heavy metal toxicity is more of a detox protocol.
Great, thank you for that. And thank you, Peter and JT, for those questions. We have another question here. 38-year-old experiencing symptoms of long haul COVID and looking for recommendations.
Yeah, great question. So again, I'd want to look at what are the potential other things, what are the other stressors that might be contributing to the long haul symptoms, but things that we could do to probably get the 38-year-old, get you feeling better soon, or on the soon end, would be ozone therapy and peptides. So those are kind of heavy hitters that are going to get you feeling better soon, in addition to all the other mitigation, all the other treatments, all the other supplements that we talked about. Some of them are going to take a little bit longer to act. So I like to ideally get that fire out and get people feeling better as soon as possible while we're kind of looking for what the underlying thing is. So it turns out that you have a chronic infection, you have chronic Lyme, let's say. That's going to make it hard for you to get your long haul symptoms gone until we get rid of the Lyme. But what we can do is do things like ozone peptides to basically make your biological systems more robust while we're trying to identify what made you tip over to have the long haul symptoms, which in this case, if it's Lyme, then once we identify that, then we can treat the Lyme. Ozone's really good for Lyme as well. So by starting with ozone, that's going to help with things like any chronic infections, including Lyme and mold as well. Good question.
We have another one here, but inflammation. What is the best way to track our level of inflammation, and how do we know if we are inflamed?
Oh yeah, that's a great question. So from a lab standpoint, a couple of the labs that we like to use to track inflammation are a lab called high sensitivity CRP and another lab called homocysteine. There certainly are people who have normal levels of both of those and still have inflammation, but I think if that's like a good start. If those numbers are elevated, then we definitely want to address that before anything else in your labs. And then other things that we can do to track inflammation is oftentimes inflammation causes various symptoms in our body. So things that I notice is, if someone has chronic knee problems, for example, and then they eat a bunch of sugar, like this happens over the holidays all the time, that people kind of fall off the wagon, eat a bunch of sugar, eat a bunch of gluten, eat a bunch of dairy. Those are the three whites that I consider to be three of the biggest triggers for inflammation for most people. So then their knee pain starts acting up. Another common thing is premenstrual syndrome. People think that that's inevitable, or menopausal symptoms are inevitable, but those are related to inflammation as well. So you'll notice if your body's inflamed, you're more likely to have more symptoms. And so by keeping kind of a daily journal of how you're feeling, you can track it in that way as well. Good question.
Great, thanks for that. Thank you so much for these questions. They're wonderful questions. We're a little bit over, so we're going to call this one the last one. This person is wondering about asking you to speak a little bit more to the risks and benefits of supplemental NAD.
Oh yeah, great question. So back to that balance again. So anytime that we are increasing our NAD levels, it's going to support our biologic systems. It's going to support our metabolic health. Ideally, we're doing that endogenously, meaning we are improving our biologic system so that we have enough NAD rather than taking it supplementally. But taking supplements of either NAD precursors or NAD itself, either via IV or subcutaneous injections, that's certainly a way to keep the NAD up. That's going to also increase your metabolic health and your ability of your mitochondria to produce ATP, which is its energy. Over a long-term period, though, I would recommend things like ozone therapy to help your systems to be healthier, to produce NAD, or to keep it's not really producing NAD. It's a ratio of NAD to NADH, and we want there to be a lot more NAD versus NADH, 700 to 1. Things like fasting are going to increase that ratio. Exposure to heat shock proteins, cold shock proteins as well. But to answer your question, in the short term, if you're suffering from long haul COVID, for example, taking NAD supplementation can certainly help to make your biological systems more robust so that you're in the more healthy state versus disease state, looking at this balance analogy here or diagram. Great question.
Great. Well, thank you so much again, Dr. Mulcahy, and thanks to everyone who joined us. We'll look forward to seeing you at the next one, and happy Tuesday.
Thanks, everyone.